Good morning again, everyone. My name is Whitney over at Health Trust Software, and this morning we are going to be talking about creating a Medicare plan of care. Now, we're going to be looking a lot in the point of care program, but there are some initial setup options that I do want to kind of cover with you guys. Maybe some new options or some options that are available right now that you guys aren't aware of, and you can start getting those set up to better help your clinicians out in the field. Now, the first thing that we're going to look at, as you can see, I'm showing my dashboard right here. So I am actually on the online system. I've opened up an internet browser and I've gone to the Health Trust Software homepage at www.healthtrustsoftware.com. This is the online system, and I will actually be looking at the online version of point of care, although anything that I cover today other than the actual setup will also be available in that offline version of point of care, which a lot of you may have downloaded on your field staff devices, or if we have the field staff actually listening in today, that would be the little icon that you guys see on your desktop that actually opens up a program that has a big sync button that you sync daily. Now, on the online system here, the tab that I'm going to look for as an administrator to set up some of the custom interventions and things like that before my field staff actually go out and do the plan of care is going to be the Reference tab. So I'm going to go to Reference and then Interventions. Now again, you have the Add option that shows up here to the right hand side. I'm going to go ahead and simply click on Interventions though to take me to my main interventions page. Now on this page, you'll be able to see a list of all of the interventions that have been added into the system. It'll give you a brief description of that intervention, also any keywords which can link it to a particular diagnosis, the type, the current status, and then you have an option over here to the right to view details. Now you can click on any of these interventions to actually go in and edit them, or you can select Add to actually go in and add a new one. Now, for the sake of this training, I've already actually customized an intervention. So if I do my advanced search, I actually added in this little intervention here that I have on my notepad. It's a goal for the diagnosis of hypertension. That's code 4019. Okay, so what I'm going to do is I'm going to click on my advanced search, and under the problem, I'm just going to search for hypertension. You can choose the order by or the discipline if you've actually limited them to a particular discipline. I'm just simply typing in hypertension and I'm going to click search. Now here's that goal that I've already added in. Remember, I can click directly on it and that'll take me into my edit intervention page where I can make any changes that I needed to. You'll notice in this page, this will actually look identical if you were adding in a new intervention, but I have an unlimited text box for the description, which would actually be the goal or the assessment or the instruction itself. I have a keyword list where I can enter in diagnosis codes or maybe the actual diagnosis name. Make sure that after each diagnosis name and also after each code that you separate those with a comma. You always want to make sure also that there's a comma at the very end, even if there's going to be no diagnosis or anything after it. You can use the Add Keywords button here to actually open up a diagnosis keywords page. You can start typing in the diagnosis number, and as you can see, it shows up here in our drop-down list, and then it automatically changes it to hypertension and inserts that comma. You can also enter in the code down here at the bottom so you can see it links that code, leaves that comma even though I'm not linking anything after that, and then I can choose Add, and that's simply going to add those into that box for me. You have options available just underneath the add keywords so that you can actually scroll through this little list here and select who can actually order this particular goal. Maybe it's an instruction or an assessment. As you can see, if I scroll up a little bit further, I've actually already selected SN for my skilled nursing. Who can perform this? I've also selected SN. Use the drop-down box to select the type, whether it's a goal, an assessment, instruction, or maybe it's a new procedure that you're adding in or customizing. And then make sure, if you want it to be active, that you have the status set to active. Your submit button is at the very top of the screen, so you're going to click submit to save it. That'll actually refresh your page and take you right back out to your main list of interventions so that you could add in another one if you needed to. Now what we're going to look at now is the actual point of care program and how that plan of care is created. Since I'm using the online version, I can either use the Schedule tab and go down to Point of Care, or if I click the little house icon and go back to my dashboard, depending on whether my administrator has given me access to the online system and also this dashboard, I may have a Point of Care button that shows up here. I also could simply look at my weekly calendar and click on any of these visits. Now I already have an admission visit that I have in mind that's actually not during this week, so I'm going to just simply click on the Point of Care button to go into my Point of Care program. Now this page, if you're using the offline version of Point of Care, should look identical to what you guys see once you select the big blue Schedule button after you've synchronized that offline version. You have your different display and grouping options up here across the top of the screen. Now I've already selected my Show Confirmed Visits option so that I can see visits that I've already completed. And then I've also grouped this page by task, so all of my types of visits show up in this orange bar. Now doing this, typically you'll only see the types of visits for the discipline that you are. I'm in our training database, so I see a little bit of everything. For the RNs out there that are watching this webinar, you guys would obviously see the different OASIS visits maybe that you have on your schedule, routine visits versus your start of cares and recerts. And I'm just simply going to scroll through this list until I get down to my skilled nursing admission visits. Now I'm going to click on a new one just to show you guys the page that we're actually going to be going to. So when I click on this colored bar for Mikey Test, I see it's my admission visit from 8/9 of 2012. Hopefully you guys have already done an admission visit if it has a date of service that old. But I'm going to select the Start Visit button, and that takes me automatically into that Point of Care visit. Now since we're not going over the entire OASIS, I'm actually going to use my Quick Jump to Category box up here in my upper left-hand corner to jump to my Plan of Care page. Now sometimes if you're on a smaller laptop or a smaller computer, because the screen is smaller, sometimes this Quick Jump to box may show up more in the middle of your screen, but it should always be located at the top, somewhere around your forward and back arrow buttons. Now once I'm on my Plan of Care page, I'll actually see a big green button that says Create Plan of Care. Now hopefully by the time that you get to this place, you've already gone through your entire assessment or gone through most of your assessment and at least answered those teal questions that may show up that are related to the Plan of Care. If you haven't actually completed the entire assessment, or at least the required fields in order to create your Plan of Care, when you select this Create Plan of Care button, you may get a list of error messages that you need to correct before it'll let you go in and actually complete or create that plan of care. As you can see, I have quite a few since I went into a brand new visit that I've never documented on. You can always click on the blue link and that will actually take you to the page that has the error message. You could then use your quick jump to category to jump back to your plan of care page. Click on that Create Plan of Care button again. And as you can see, if I scroll down, that last error message that I had just corrected has disappeared off of my list. Now, in order to actually show you guys a plan of care, I've already gone through and completed an assessment. So bear with me, I've paused your screen so I can scroll down and actually go into the one that I've already completed. Okay, so this is the page in my admission visit, the plan of care page for Mr. Donald Duck. As you can see, I've already actually gone in and created the plan of care, so I no longer have that big green Create Plan of Care button. Now what I do have is an Edit Plan of Care button, and this is actually working the same way as if you clicked on the Create Plan of Care, except I'm just viewing one that I've already created. When I select that Edit Plan of Care, or if you guys were to select the Create Plan of Care button, and you've corrected any error messages that have showed up in that list, you'll actually be taken to a page that says that your visit data was validated successfully. Now if you happen to scroll through this page, and I'm actually going to make a small change here so that you guys can see an example. Let's say on the therapy need question, you answered NA. You only want to select that box if you don't want it to automatically calculate that HIPS calculation and everything on your OASIS. So if you get to a page like this and it tells you that your visit data was validated successfully, but it's telling you that no HIPS code, claim key, or payment information is applicable, it's letting you know that it's because that M2200 has NA selected. So if you need to go back, if you accidentally answered that question incorrectly, just jump back over to your therapy need question and make sure that you read these instructions and enter in 000 if no therapy visits are indicated. As you can see, if I jump back over to my Plan of Care page and click on Edit Plan of Care, that's quite a bit of difference. It actually pulls up that HIPS and HERG and claim key calculation. It also tells me my clinical points and functional points, tells me which questions I actually received what points for. As I scroll through this information, towards the bottom, it may give me an additional OASIS analysis, so letting me know here that the patient has some psychiatric symptoms according to these particular questions, but I actually didn't add in a diagnosis of any psychiatric disorders. So it's just letting me know that it could potentially add some points to my clinical domain. So I may want to think about going back and reevaluating those diagnoses or just making sure that I've entered in the correct ones for that patient. Now you can click on the Continue option to just continue and skip past these warnings. Just keep in mind that whoever is actually doing that care validation of your visit can also see these additional OASIS analysis. So if it's something you think they would maybe fail that visit back to you for, you may want to go ahead and go back and make that change. I'm going to go ahead and select Continue to move to my next page. On this page, the title says Identifying the Problems, and that's exactly what we're going to be doing, is identifying the problems that need to be addressed this particular episode. Now, as you can see, it's automatically pulled in the diagnosis here that you filled out on that diagnosis page of your assessment. So you can select the diagnosis that you'd like to address that particular episode. You also have a list of your process management down here at the bottom. Now we do allow you to check as many of these as you want to. We do recommend not selecting all of these. Keep in mind that each of these that you select is probably going to have quite a few sections underneath them as far as different goals, instructions, procedures to actually address. And so you want to make sure that you don't select too many so that those goals and things aren't attainable during that episode. It also gives you, and I've lost my word here, it also helps you guys actually retain your medical necessity if you don't select all of these. So for example, if I select all of these, select all of my goals, when it comes time for the recert, since I've already selected all of these, my plan of care for that next episode is probably going to look extremely similar. So by not selecting all of these, it actually helps you guys retain that medical necessity from episode to episode. So I've just selected a few different options here, and I'm going to click on my Continue button to move to my next page. Now you do have a back button, so you can always go back to the previous page. You have a cancel option, which would just close this screen, and then you also have a little jump to box here in your plan of care. Now keep in mind, when I'm clicking on these Continue buttons, I still have this pop-up window here, so I'm still actually inside that creating a plan of care option. So if I close this screen without finishing it, I actually haven't finished creating my plan of care. So make sure that you keep clicking on Continue to go through until the system tells you that you've successfully created that plan of care. Now this second page that we're looking at here is going to be to establish the visit frequencies. On the top of the screen, we do give you some helpful instructions or tips as far as how to enter in those frequencies. Your different disciplines actually show up here to the left-hand side. You have a frequency box, a date field, and then also any special instructions. Just below that, you have an option to show the calendar. Now this option isn't actually going to let you schedule from the point of care program. That's typically something that takes place in the office and takes place from one of our other scheduling menus. But what this show calendar option is letting you do is it's pulling up a suggested, or basically what that episode schedule is kind of going to look like. So it'll number out your care weeks. You can see the start of the episode based on that start of care date that you had entered in, and then the end of the episode are highlighted in green. And then it kind of numbers out the care weeks to the left-hand side so that you can easily go through here and kind of plot out maybe the frequency that you need for each of those disciplines. Just click on the red X to close that screen when you're finished. If you need to actually send a note to your scheduler, you do have another link next to Show Calendar that says Send Note to Scheduler. This will allow you to easily select or check boxes that let that scheduler know maybe when the patient prefers visits, a particular day of the week, or maybe a particular time in the day. Any additional notes or things that you may need to actually notify that scheduler of. For example, maybe the patient has a B12 injection on every other Wednesday, or maybe they have a doctor appointment on a specific day of the week, every week or every other week. You can write that in there. And where this actually shows up for any schedulers that may be listening also to this webinar, this will actually show up at the very top of your patient's episode schedule. So when you're scheduling in the online system and you go to Schedules and Episode Schedule, or if you're actually in the patient menu and you're looking at that episode schedule for that patient, all of this information, if it was entered, will show up right there at the very top. Now you also have an option that says click here to create an aid care plan automatically once the visit is confirmed. Now if you've entered in a frequency for your home health aid and your starting date, maybe any special instructions, you'll actually be able to create that aid care plan at the same time that you're creating the plan of care. So make sure that you select this checkbox if you want to create that aid care plan. Now once I've filled out this page, I'm actually going to click on Continue to move to my next screen. And this is going to be our Common Order Information page. Now on our diagnosis page, we didn't actually look at that page, but you have up to 10 boxes to fill in those diagnoses. If you actually needed to add more than 10 diagnosis codes on a plan of care, we give you an unlimited text box here for you guys to add those in. You can either type in that diagnosis name or the actual code itself. The next option here is probably one of the most misunderstood fields in the system. So we'll clarify this a little bit for you guys. Now a lot of people, when they're going in and they're trying to create them specific to their agency or to their company, they think that by selecting this first option and then changing these boxes will actually default that to whatever they've selected. This Use Agency Parameters option is actually defaulting to what we at HealthTrust have entered in or saved as kind of a template for those vital sign parameters. If you need to make them specific to your own agency or your own patient, you need to always select this second option, and then you would make the changes to the boxes below. If you use the first option and then make the changes in these boxes, it will still always default to those HealthTrust software parameters. So make sure if you want to customize these boxes here either to your own agency or to your patient, that you always select the second option. Make any changes to these boxes that you need, uncheck or check them depending on whether you guys need those on the plan of care. And what this is going to do is actually customize those vital sign parameters so that when you go out and do your routine visit, or if an LVN goes out to do their routine visit, they will actually see those updated parameters out to the right-hand side of each vital sign on their vital sign page. If you have any other order information or other information that you need to actually show up at the beginning of the order section when you're printing out that plan of care, we do provide you with an unlimited text box here for you to type in that information. I'm going to actually click Continue to move to my next page. Now the next 4 pages actually look almost identical. So make sure that as you're flipping through these pages that you actually read the instructions up here. Sometimes they can be very helpful. And make sure that you're paying attention to the title of the page, because again, you'll see as we flip through them, they do look almost identical, except the title and some of the instructions may change. Now on these next few pages, this is actually where that interventions option that we had looked at in the beginning of the training comes into play. So as I mentioned before, I'm going to pull up my sticky note here. I've actually added this hypertension goal in as a custom goal. Okay? I've linked it to that code 4019. Remember, no decimal points in our system. And I've also linked it to the word hypertension, so that when I get to my goal page, or when my clinician gets to their goal page, instead of selecting that blank option, or if they click on that diagnosis code and nothing shows up, if I actually click on hypertension, oops, and for some reason mine isn't showing up, maybe I made it inactive. If I actually click on hypertension, that custom goal that I had added in for my patient will initiate lifestyle changes that will permit blah, 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 that would actually show up here in this section. And I did a lot of playing around before our webinar, so I must have actually made that inactive. So I apologize for that. But you guys will start to see those showing up here Now before, you always had the option to come down to custom, and then your clinicians could actually use the magnifying glass to pull up a list of attributes, and you could have added in custom goals or instructions or procedures in this attribute list, and then they could have clicked submit, and that would actually insert that in the box. That interventions option that we've added in is kind of taking the place of that, so it's making it a lot easier for your field staff to just simply click on that option or click on that diagnosis or process management and actually have that option show up. Now you'll notice as I select through some of these other options, I do have some little check boxes and some different options available here. So you can just simply check the ones that you want to actually go on that plan of care. If you checked one that has a blank box, out to the right hand side we will kind of tell you what we're looking for in that box. So a date, here we have insert a date or a time frame, and then simply clicking on that blue box again or that blue colored bar, that'll just close those options so that it goes back kind of to the main screen. You don't have to close them before you click continue, but sometimes like your custom list or your all interventions list can be pretty lengthy, so you'll have to scroll down quite a bit. I like to just close mine because it brings my continue button right up in front of me so I can easily click it. Now again, moving to my next page. There we go. Oops, skipped too far, I think. Nope. Moving to my next page, again it looks almost identical. So at the top I now see though that it says selecting assessments instead of goals, and it's going to work the same way. Just select the one that you want, check off the check boxes for the different assessments that you need to assess that particular episode. Again, if nothing has been customized under some of these sections, you may not have anything that shows up. If you need to actually add in a custom one, you can scroll down to the custom option, type in your custom assessment here, and then simply check that checkbox so the system knows that it needs to include that option on the plan of care. Clicking continue takes me to my next page. Now again, looks identical, but it is actually my instruction page. Instructions are going to work the same way. The only difference is that to the right hand side we now have two additional boxes. Now the first box that we see is simply a number box, and what this is going to allow us to do is actually type in the number of times that it needs to be instructed on. Now make sure that you're not spelling out the number. You always want to just use the actual number itself instead of the word. And then to the right hand side you can use the drop down box to select the priority of that instruction. What this is going to do is on the routine visits the system will prioritize all of these instructions, and it'll actually keep track of the number of times that it's been instructed on and also the number of times that you selected here on this plan of care for that instruction to be worked on. It's going to work the same way with your custom instructions. So you'll notice next to that custom box we have our box for the number of times that it needs to be instructed on, as well as the priority. Just don't forget to check that checkbox to include it on that plan of care. Clicking continue is going to take me to my procedure page. Again, it works the same way. Click on that blue colored bar and then just use the check boxes to the left hand side of those procedures to check off the procedures that need to be done. This is going to actually pull those procedures to the procedures page in the routine visits, so whoever's doing that routine visit can simply check off that procedure that it was done and add in their comments. Clicking continue takes me into my aid care plan. Now if I had actually entered in a frequency on the frequency page for my aids, that would have pulled this frequency over here into this box. I can type in my medical necessity, any safety precautions, allergies, things like that. And then I can scroll through my list of tasks. Now these tasks can be broken down into different sections, and they can actually be customized by your agency, and you can customize those by using this reference tab. If you need additional help on these tasks or setting these up or customizing these or actually customizing those interventions that we had talked about earlier, if you will get in touch with the training department at our office or maybe send us an email, or if you want to, you can shoot me over a question before the webinar ends, and I can actually contact you and your agency about getting those set up, and we can set up training. But just scroll through the list of tasks and actually check off the frequency, and then also enter in any specific or special instructions. If your home health aide or if your aide is actually using the point of care program, when they go in to actually do their visit, the only tasks that will show up on their visit are going to be the ones that you guys selected here. You have your option to e-sign at the very bottom. It looks like I actually e-signed this one back on 8/13 of 2012. You would have an e-sign button here instead of unsign. Mine says unsigned because I've already signed it. And once you've signed it, click continue to move to your next page. Now I do see we have some questions that it looks like have come in. So I will actually review those questions at the end of the webinar and answer them, and we'll also post additional answers to those questions when we post this webinar video today. Clicking continue took me to my review plan of care data page. This is just going to summarize all of the information that's going to be included on that plan of care. Here we have my vital sign parameters that it says that I set up to be patient specific. All my instructions and procedures that I selected, my goals. Clicking continue takes you to a page where you basically will confirm your plan of care. You also have your M2250 that you can answer while you're on this page. And just below that, we provide you with your physician information and their phone number so that you can actually call and get that verbal order start a care date. Remember, if you're manually typing in this date, it's always going to be 2-digit month, 2-digit day, and then 4-digit year. Or you can use our magnifying glass to the right-hand side to actually select the date out of that calendar. Now I've already signed mine here. Unlike some of the other signing options in the system, we actually don't have an e-sign button. So if you have a touchscreen computer, you can use your stylus to style in this box, to actually sign in this box. Or you can use your mouse. Now I do this quite a bit, and this is about as good as I can get my signature to look. You can sign your name, put your credentials behind it. The little blank piece of paper just simply erases that entire thing. If you mess up and you want to just backspace the last option, you can use the little arrow, and that'll just erase the very last thing that you had done. If it's easier on this screen to put your initials and then your credentials, that also may be acceptable. Just make sure that you check with your administrators at your office so that you can ask them kind of what an acceptable answer is per your policy for your agency. So once I've actually signed this area here, I'm going to click confirm, and the system is telling me that I successfully created my plan of care. I'm going to select OK, and I'm going to close my little notepad here that I had open with my hypertension diagnosis. And then that takes me over to my patient signature tab. Okay, so I could just finish the rest of my visit. Make sure that you get your patient signature or use one of our alternate signing options. Now I'm going to actually click on the red X to just save and close this visit. After you have finished your visit, you'll make sure that you want to click on that green check mark to actually turn it into the office. But we're actually going to look at a research visit and kind of what the plan of care looks like and some different options that you may see in the research visit. So I'm just clicking on my red X here, the big round circle one, to save and close that visit and take me back out to my schedule. Okay, so once I'm on my schedule screen, I'm actually going to scroll down and find a research visit. And I'm actually pausing y'all's screen because sometimes scrolling through all of these colors tends to make your eyes a little sick. Tends to give people headaches. So here we go. I've scrolled all the way down to the bottom of all of my visits, and here I have my skilled nursing research visits, and I have one here that I've also completed, so I'm just going to actually use that one. Now when I click on my colored bar, because it's a green visit and I've already completed it, my Start Visit button has changed to an Edit Visit button. So I'm going to click on Edit Visit. Again, that's going to take me right into my documentation, and I'm going to use my Quick Jump To box to jump to my Plan of Care page. Now again, if you hadn't actually done this research, you would most likely go through, complete all the documentation that you may need in order to create the Plan of Care. And then once you get to the Plan of Care page, just like that big green Create Plan of Care button that we saw in the admission visit, you'll also have a similar button here that's big and green and says Create Plan of Care. I've already created one for this particular patient, so I'm going to use my Edit Plan of Care option again. If you're wondering what the View Plan of Care option does, it just simply brings up that summary page so that you can view a summary. I'm going to actually click on Edit Plan of Care though to go back into my Plan of Care. Now you have the same screens that you had when you were creating that Plan of Care in your admission visit. So you have the same options to send the note to scheduler. Don't forget to check that checkbox if you want to actually create that aid care plan. Remember, only use the first option if you want to use our Health Trust software parameters. Otherwise, if you're using one specific to your patient or your agency, always check that second bubble and then make any changes here that you need to. We have our goals page. Now as you're going through, if you actually come across one that's in red, what this is telling you is that this has actually been included on a previous Plan of Care. So what this is letting me know is that maybe on my admission visit, this was actually a goal that I worked on with this particular patient. You'll notice I still have a checkbox to actually select that goal. So I could still instruct on that goal. Let's say maybe they didn't reach it, or maybe we were actually on our instruction page and we needed to continue instructing on that. We can still select them. This is just letting us know that we've already used it, to kind of help eliminate any repetitive teaching and make sure that those plans of care are different between episodes or with the next episode to help you guys retain that medical necessity. Okay, so again, as we're going through these different pages, I'm just clicking on these drop-down options here, these blue colored bars. Anything that shows up in red would actually be something that was already included on my previous Plan of Care. Works the same way for your instructions. You have your different options here. Again, if I had instructed on any of these items, they would show up in red, kind of like these are under my common option. And then just keep selecting Continue to move through those pages, filling out the information. Again, you have that aid care plan, your summary page for you to review the information, and then your option to sign and enter in that verbal order start of care date. And then don't forget, when you're finished, don't just close the screen. Make sure that you click on Confirm. That way it'll successfully create that Plan of Care, and then it automatically takes you over to your patient signature page. Okay, now I'm going to actually scroll through and look at some of the questions that we have available, or the questions that have been asked. Bear with me, I'm trying to make the screen a little bit bigger. Okay. Let me see. The first one here says, can we not use this and not have it show up on point of care, i.e. priority and times? I believe that question was asked when I was going through a specific section. So if you guys wouldn't mind just typing what particular section that pertained to so that I can go back and better answer that question. Again, that was the question, can we not use this and not have it show up on POC, i.e. priority and times? All right. There is another one mentioning some of the diagnosis and care paths not showing up or not coming up with interventions when creating a care plan. I'm assuming that's in reference to this reference and interventions option. You may have customized some of those and they're not showing up. So what we'll do is I'll actually contact that agency directly and we can review those interventions, make sure that you have everything set up correctly. We haven't had any training before really on how to set up that reference and interventions tab. So it could just be something as simple as something isn't selected, but we can definitely address that with you and make sure that you are set up and ready to go. Okay, and it looks like there was another question about procedures that you choose for the aids cross over to the aid notes. Okay, and so I'm assuming the procedures that you guys are talking about is when you're on this plan of care page. Let me just jump back over to it real quick and click on Edit Plan of Care. And I'm just going to jump to that page. I'm assuming what's happening is you guys are on this selecting procedures page. You actually have some maybe custom procedures or some procedures for the actual aids that you're selecting here. And what's happening is those are not pulling over to the aid care plan. This procedures page is just simply designed to actually pull over the procedures that the nurses would need to perform when they're going out and doing those routine visits. If you need to actually customize maybe a procedure that an aide needs to do, once you get to this aid care plan page, you can actually customize these options here. So the tasks that show up, you can actually customize what shows up here. And so you could add in those custom procedures that you need that aide to do, and that way it will actually pull over to those aid notes when they are using the point of care program. And we can actually contact you guys directly to help you set those up and just make sure that they are pulling correctly the way you guys would like to see them on those aid notes. Okay, and going back to the first question, can we not use this and not have it show up on point of care, i.e. the priority and times? And they answered me back and said instructions. And so let me jump back over to that instructions page so we can address that question. Okay. So on this page, if you guys are actually selecting the instructions, if you don't fill out this information to the right-hand side, you can actually still have that show up on those routine visit notes. we would actually recommend that you guys still fill that information out. The reason being is by filling out the number of times that this is instructed and selecting that priority, the system is actually using this number to track the number of times it's instructed on. So it really helps eliminate kind of duplicate teachings. So as you're going out, if maybe you only needed to instruct on it a certain number of times and you have already instructed on that the number of recommended times, the system actually highlights it in a bright red so that you can maybe add in an additional comment as to maybe why you needed to continue to instruct on it past those times. So I would still recommend filling out the number of times that it needs to be instructed on and the priority. Okay, and it looks like the question about the procedures, they added an additional common option. And so we'll call you guys directly so that we can address those problems that you're having with that aid care plan. Let me scroll down a little bit further. Okay, there's another question about those procedures on the procedures page. Again, anything on this procedures page that you guys are documenting, even if they're under this common option, like for example, we have these home health aid options here, they're asking if these, why don't these actually pull over to the procedures on that aid note. We will go ahead and release the answer to that question when we post the webinar video for this so that we can clarify that and kind of go through all of the different sections and clarify that a little bit better for you guys. Now we do have another question. How do we modify the orders that have changed after the visit but the same day? Okay. So modifying the orders that changed after the visit but the same day, I'm assuming the same day as the plan of care, or the same day that that visit happened where that plan of care was created. Okay, so if the visit actually hasn't been passed yet through that care validation screen, so under compliance and care validation, if the visit actually hasn't been passed yet, you could actually fail that visit back to your clinician to have them make those changes, or if you needed to actually modify the orders via a physician's order, so if you needed to add in a physician's order, you could go to Orders, Physician's Order, and then choose Add. And then once you get down here to this Orders option, if you're updating a goal or an instruction or a procedure or something like that that needs to actually pull over to those routine visits, after you fill out this order section, just make sure that you click on the Interventions button. And I didn't select an episode, so it's telling me that I need to select that before I continue. But you would want to click on the Interventions button so that you could actually link those to all of those routine visits. And we'll actually hold another webinar about creating those physician's orders, so that'll clarify that Interventions button a little bit more for you guys, and we can actually contact the person that asked that question directly to get some clarification in the meantime before we can host that webinar. Okay, and it looks like those are all of the questions. Again, we'll be posting this webinar this afternoon, so be looking for an alert in the system with the webinar video, and we also are going to be posting the questions that were asked during this video. So if you need clarification or if you need to refer back to maybe an answer that I gave, then those will be available. I don't see any other questions, so we are going to go ahead and end there. I hope that this was very helpful for you guys, and again, if you have any additional questions, look for that alert, or you can always submit a support ticket by going to Help and Support, and then send us a support ticket if you need additional training or additional help setting up that particular interventions option here, or if you need help customizing those aid tasks. And thank you guys for watching.